Hello, my name is Pamela Pierre, and today I will be presenting a PowerPoint on care coordination. This is for Capella University, and this is July 2020. As nurses, our role is vital to coordination and continuity of care for our patients. It is imperative that we recognize how each aspect of this comes into play. Cultural, physiological, policies, safety, and ethics each play a very important role in our patients' care. This care must include the utilization of community resources and maintain the code of ethics that we are responsible for. The better comprehension that we have of this code of ethics, the more effectively we'll be able to care for our patients. Collaborating with patients and family to achieve desired outcomes. To effectively manage treatment, it's vital to collaborate with the patient and their involved family members to determine the continuum of care in the most effective manner. The identification and the classification of various approaches that are used should be a priority. By ongoing systematic review, family and patient engagement in a systematic and structured process can be achieved. The quality of patient care is vastly improved by employing these techniques. When both the patient and the family are actively involved in the plan of care, including setting goals and interventions, taking into account individualized factors, a better outcome is the natural conclusion. Creating a satisfying patient experience. In order to identify the aspects of change management that directly affect the elements of the patient experience, essential to the provision of high-quality patient-centered care, we have to identify the collaborative patient goal coordinated together with all of the aspects for the very best outcome. It needs to be accessible to that specific patient, and it needs to be sensitive to the emotional well-being of the patient, in addition to their comfort, their participation in the plan, the degree to which they will become involved, a positive relationship between the provider and the patient, and the setting in which the care is provided. These are all very important elements of success. Decisions based on the Code of Ethics for Nursing. The rationale for coordinated care plans based on ethical decision-making is that all patients have the right to their privacy, good provider care, fair payment from their source of coverage. Our role as nurses is to improve the function and the realistic goals in the coordination of care. We need to address the needs and the values of the organization and the patient, as well as the professional and the community. So it's complicated. It's something that we work on together with all of the providers, trying to make the correct outcome, the best patient success outcome. That becomes our goal together as a group. The patient has the right to choose the care that is based on their own personal beliefs and on their values. The ethics that are primary that we're considering are justice, non-malfeasance, beneficence, and autonomy. As nurses, we have to be educated. We have to be willing to speak out on behalf of the code of ethics. If we're not educated on it, we can't speak intelligently on it. How healthcare policies affect patient-centered care. The potential impact on specific healthcare policy provisions and on the outcomes of the patient experiences is better coverage for people with pre-existing conditions, free preventative care, of course, more coverage options, less limitation on essential benefits, and this protects the patient's choice of doctors. The improved access improves the physical, the social, and the mental well-being of the patient. Preventative care reduces the costs, it expands the survival rates. More coverage options increases the use of the appropriate health service at the time. An example of that would be something that I know that our hospital experiences a lot. When you have a patient that is not really content with their care, the patient will tend to not be compliant with their correct care. And what ends up happening is the patient shows up in the emergency room and has to get their care done in a setting that is not really appropriate, or they may not be compliant medically, and they have to come to the emergency room, and they will only do so when they are really, really sick. So they've waited too long because they're not happy with their care. So they're basically trying to conform it to what they want it to be. The improved continuity of care becomes promoted when the patient has more choice in their own care. There's a greater opportunity for overall health outcomes for these patients. Effective strategies for collaborating with the patient and family to achieve desired health outcomes. We as care providers need to make sure that we are utilizing an effective evaluation process. An effective evaluation process would be defined as setting up your plan, taking everything into account that is in play with this particular patient, having ongoing monitoring for this particular patient. You would have constant revisions. As you know, if something doesn't work, the best idea is to change it or modify it until it does work correctly. So as a care provider, this would be something that you would do. You would evaluate the care, you would modify it as needed, and then revise it again, very potentially. If something still wasn't working correctly, you would modify again. And then you would reevaluate it again. And after all this occurred, every single step of the way, something very, very critical for you to do is documentation. You have to document what did work, what didn't work, what the patient liked, what the patient didn't like, how the family related to the care of the patient. You also need to do drug-specific educational interventions. We were talking a little bit earlier about patients who are not compliant with their care, and medication, appropriate medication administration is very much part of care. So for drug-specific educational interventions, you want to ensure that your patient receives all the appropriate education regarding their disease management, how to administer their medications appropriately. In order for them to comply, you really need to educate the patient on their disease, fully educate them on their disease, and make sure that they are understanding the process in their body. And I work on a stroke floor. And one of the first things that we do after someone's had a stroke and they have regained their faculties, they're thinking clearly, we educate them. What is a stroke? What type of stroke? Ischemic, hemorrhagic. It's very important that you understand what's going on with you in order to comply, so that you understand what the result of not complying would be. So you, again, ensure that the patient receives the appropriate education regarding their disease management and how to administer their medications appropriately. This is another part of the continuum that ensures that the patients are educated regarding their illness. This patient education will reduce costs. The patients are less likely to seek emergency assistance. When they are properly educated about their illness, if they know how to administer their medications, they may go to the hospital if they're having an adverse effect from wrong medication administration, whereas if they had been educated, they would know that this was a common side effect. They would say, oh, okay, well, my heart's a little irregular because I took that medication a little too close to the other dose, and so it kind of sped up my heart a little too much, or vice versa. And really, they may have to go to the hospital if they take it wrong, but them being educated is going to improve the patient outcome. It's going to reduce incidents of a patient having to go to the emergency room or something else. The aspects of change management that directly affect the elements of the patient experience essential to the provision of high-quality, patient-centered care are the correct care at the right time and the right place. Again, a good example of that is patient education, when they're calm, when they know what's going on around them, and they're what we would call ANO4, alert and oriented times 4. They know where they are and what's going on, and they're mentally in a good place. The patient preferences, this is really, really important. I know it seems like just allowing people to be picky, possibly to some people, but this is vital. Patients aren't going to comply if they don't agree with what you're doing or how you're doing it. So if something is not working for them, the way to get them to comply is not to try to force them to do it or convince them to do it. This is where that evaluation, reevaluation, and possible modification comes in. In order to get a patient to comply, you're going to have to meet their preferences as closely as possible. You don't want to just go around threatening a patient and saying, oh, well, if you don't do this, you're going to die. Maybe they will. Maybe that would be the end result. That's not the way that you deal with people. People don't respond very well to that. You're very likely to cause a panic attack. Something else, again, that's been mentioned, but participation of family members is huge. Maybe their daughter will call them and say, hey, did you remember to take your blood pressure medicine at 7 a.m.? And the mom says, oh, I forgot. I'm so glad that you called. Having the family participate, whether they live in or out of the home, is vital. The family participating, not only may remind someone or may make them familiar with a sign or symptom they may see and be able to, know that that is okay, normal, or know that it's not normal. But family participation also makes that patient feel loved. And that is huge. If your patient feels loved and they know that their family wants them around, they're a lot more likely to be compliant with their program. And also it gives them somebody else to answer to who maybe has a better insight on dealing with their particular personality because they've known them all their life. Timely information sharing. Huge point. Timely information sharing is critical. If you don't share a piece of information that is vital to a doctor's plan of treatment, then what's going to happen? That is going to be that, that doctor may prescribe something wrong, or that doctor may not prescribe something that was needed at the time. So it's really critical. It's not just doctors, it's physical therapies. Hey, they kind of twisted their ankles, so we may not want to have them up and around today. We may want to give them a couple of days for the soreness to wear off and maybe just do an active range of motion instead, depending on the illness or whatever. It's very important that you know what's going on with your patient. Each and every provider needs to know what is going on with the patient so that they can appropriately care for the patient. So again, the aspects of the change management that directly affect that high quality patient-centered care would be the correct care at the right time, in the right place, the patient preferences, the participation of the family members, and the timely information sharing. You know that when you need to know something about somebody is when you're treating them, not after the fact. So that last point can't be stressed enough, the timely information sharing. A lot of that, plays into the HIPAA. You have to be very careful about what you put and who it's accessible to, but we have to all keep each other informed on what is going on. The rationale for coordinated care plans is based, or should be based, on ethical decision making. Positive patient outcomes are much more likely when knowledge, skill, and a good understanding of ethics and good patient relationship are all taken into account. The sharing of information has to be kept confidential in order to maintain the ethical standards. And that's HIPAA, simply HIPAA. The patient has the right to their privacy. Implications and consequences of an ethical approach to care. An ethical approach to care allows for the best patient and provider relationship as it fosters a trust and security for the patient. This must be maintained as well as possible in order to have the most cooperation from the patient. The time when confidentiality might have to be breached, and I know that's going to cause a huge eyebrow raise, but when you might have to breach confidentiality is when there may be a harm that's posed to the patient's welfare. And in that case, like somebody who's threatened suicide or has just, made comments that they just don't feel like being on the earth anymore or whatever, those things have to be taken very seriously. People are going in a wrong direction when they're starting to talk like that. Underlying assumptions that might influence decision making. If patient preferences aren't documented and shared correctly, the caretaker may reflect their own values when making choices for the patient. They might assume that the patient prefers something that's really more important to them, and this is sometimes done unconsciously, which is why it is so important to keep a clinical distance and to know what the patient's desires are. Potential impact of specific healthcare policy provisions on outcomes and patient experiences. When a patient has a good experience, they normally have a better outcome and fewer readmissions, and this has an impact on the reputation of a healthcare facility as well. Logical implications and consequences of relevant policy provisions. By following an ethical continuance of care, good health can be more regulated because it is supported by the environment. Better protection for patients' privacy is achieved, and patients can be given more options for care. The evidence that continuity of care improves the patient outcomes is better appointment follow-through of those patients, less hypertension outcomes, more prescription compliance, and of course, what the whole presentation is about, better patient outcomes. Thank you for listening.